Start. Hello guys, welcome back. Now in this video, let's discuss about the special sensations. Now the first special sensation that I am going to discuss is the vision. Okay. See, for vision, what are the receptors that we are having? We are having rods and cones. See these rods and cones. These are the receptors for the light. Okay, they are the receptors for the light or for the vision, you can say. And where these rods and cones are located, they are present in our retina. Now, if you say this is the retina, the rods and cones are present in our retina. But there are certain differences between these rods and cones. What are they? See, rods are more in number, 120 million. Cones are less in number, 6 million. Rods are more peripherally located in the retina. Okay, rods are more of peripheral location. They are located more in the peripheral regions of the retina. Cones for C for C. Always remember, cones are centrally located. C for C. Rods helps in peripheral vision. Okay, not the central sharp vision, but the peripheral vision. See, if I am seeing like this, okay, there is something which is in my focus, the center. This is my central vision. But I can also see in the sides. I can also see this hand which is there in the side. So this is the peripheral vision, and there is central vision. Rods helps in peripheral vision. Cones helps in central vision. Again, one more C is coming. Cones, central vision, and located centrally in the retina. Next, rods helps in black and white vision, guys, especially during the night. In the night, you can identify the objects what you are touching. Okay, you can even, like, without even looking, you can identify the things. So rod helps in the night vision. Cones helps in the color vision. Okay, rods helps in the night vision. In the night, you can see the black and white, right? That's because of the rods. And in the morning, you can see the colors, and the colors are because of the cones. So these are the differences between rods and cones. Next, if you see retina, okay, let me show you the retina here. See, this is the retina, let's say. See, in retina, there are 10 layers present. Okay, there are 10 layers present in the retina. Out of these 10 layers, okay, I'm not going to discuss about each and every layer here. I'm going to discuss only about the things which are needed for your exams. Out of these 10 layers, there are 5 types of neurons. Okay, there are 10 layers in the retina. And how many types of neurons are there in the retina? There are 5 different types of neurons, like photoreceptor cells, bipolar cells, ganglionic cells, amacrine cells, horizontal cells. All these are the types of neurons. And you know what are the types of photoreceptors? There are 2 types of photoreceptors, that is the rods and cones. Rods and cones. So these are the 5 different types of neurons in the retina. Now try to understand, guys. This is how light is going to enter into your eye. Okay, light is going into your eye from the pupil, anterior chamber, lens, a posterior chamber, the vitreous, and light is going and falling on your retina. Okay, let's say the light is going and falling on your retina. Okay, let me give you understanding. Let's say this is your eye, like eyeball, and here is the cornea, and back here is the optic nerve. And where will be retina present? Retina is here. Let's say the innermost layer of the eye, retina. Let's say this is the retina. And you know, retina is made up of how many layers? See, in this retina, there are many layers. 10 layers are there. Okay, in this small retina, there are 10 layers. So now look at here. This is the light, the ray, light. It is entering into your eye. From the pupil, it is entering into your eye. And where this light will go and fall on your retina. On which layer of the retina? So this is the layer. The layer is called as the ganglionic cell layer. First, light is coming like this and it is falling on which cell layer? It is falling on ganglionic cell layer. So now tell me, these ganglionic cells, are they photoreceptors? No, they are not the photoreceptors. Ganglionic cells are not the photoreceptors. First, they are receiving the light, but they are not producing any action potentials. And now this light, it will go through from the ganglionic cell layer. It will go, and finally it is going to come and fall on the photoreceptor layer. Here you can see these are the cones, rods, rods, cones, rods, something like that. Okay. So now the light finally comes and falls on the photoreceptor layer, which contains the rods and cones. Now these are the receptors of light. Now they are going to take this light energy. Okay. Now they are going to take the light energy, and the light energy will be converted into electrical energy or electrical impulses in the rods and cones. So this is where the electricity is generated. Now once the action potentials are generated here, now they will be propagated. Now this electricity from the information, you can say, now the information from this photoreceptor layer, now that is coming to which layer? It's coming to the bipolar cell layer. Okay. Now the information, the light information from the photoreceptors is coming to the bipolar cells. And from the bipolar cells, this information, where is it going? Now it is going to the ganglionic cell layer. Okay, now light came like this, but the action potentials are going in the opposite direction. Okay, the electricity is going in the opposite direction. So first which cells are activated? Rods and cones. Later bipolar cells are activated. Finally ganglionic cells are activated. Ganglionic cells are activated. Now you look carefully, the ganglionic cell axons, these are the axons of the ganglionic cells. Now this ganglionic cell axons, they are coming together and they are forming nerve. What is that nerve? The nerve is nothing but the optic nerve. So now optic nerve is formed by, tell me, optic nerve is formed by the axons of the ganglionic cells. It's the axons of the ganglionic cells which are ultimately going to form the optic nerve. Okay. So let me write important points here. The photoreceptor layer are considered as the first order neurons because they are the ones which are first activated, first order neurons. And bipolar cells are considered as the second order neurons. And ganglionic cells are considered as the third order neurons. And I have told you who is the output cells. Okay, who is giving the information out of the retina? It is the ganglionic cell layer. So look at here. First light falls on which layer? Light falls on ganglionic cell layer. Light is first falling on the ganglionic cell layer. The axons of the ganglionic cells is forming which nerve? Optic nerve. So that's why these ganglionic cells are also called as the output cells of the retina. Okay, they are output cells of the retina. Done. Next, what else you should know? Guys, look at the optic pathway now. Okay, the visual pathway, you can say, how the light information is going to the cortex. We all know these are the two eyeballs, and from the eyeballs, what is this nerve that is coming out? This is the optic nerve. Okay, this is the optic nerve. Optic nerves crosses, okay, in an area. That area is called as the optic chiasm. Okay, both the optic nerves are crossing in an area called as the optic chiasma. Now, after crossing, these structures which I am highlighting right now, they are called as the optic tracts. Okay, we call it as the optic tract. Now these optic tracts, where they are going? The optic tracts are going into an area which I am showing here in the blue color, that is called as the lateral geniculate nucleus. Okay, lateral geniculate nucleus or the lateral geniculate body of the thalamus. It's present in the thalamus. So light information finally came, okay, into the lateral geniculate nucleus. Now from here, okay, from the thalamus, lateral geniculate nucleus of the thalamus, the information with the help of, okay, this geniculocalcarine tract, with the information, the light information or the visual information with the help of this geniculocalcarine tract, it is going into the cortex. It is going to the cortex. Which cortex? Occipital cortex, because occipital cortex is a place where we are actually seeing the images, where the images are formed. So in the occipital cortex, that is the Broadband's area number 17. So this is the area where you are finally making the images. Okay, the light is forming the images. So this is the normal visual pathway. Okay, again repeating: optic nerve, optic chiasma, optic tract, lateral geniculate nucleus. From the lateral geniculate nucleus, geniculocalcarine tract to the occipital cortex, Broadband area number 17. Okay, Broadband's area number 17. Next, after this, what else you should know? Okay, as a first year MBBS student, okay, from this topic, what is very important for your exams? Okay, let me tell you. Students, try to understand, this is your visual field. Okay, this is all what you can see. This is the visual field. This is all the area that you can see or I can see. Now, visual field, I am dividing into two parts. I am dividing the visual field into two parts. The central vision or the nasal visual field. This is the nasal visual field, and side it's a temporal visual field. Okay, nasal visual field and temporal. Temporal means side. So this is the my temporal vision or peripheral vision, and here is the central vision or the nasal vision. So this is the visual field. Now I am showing the cross section of the eyeballs. Let's say here are the two eyeballs cross section. From the top I am showing you. Let's say these are the two eyeballs. Means I am making a cross section like this. Okay, I am showing from the top angle. Now, and let's say here is the nose. Okay, when I am cutting like this, when I am cutting at this area, so here will be the nose, central will be the nose. Then I am showing the two retinas like this. Okay, the two retinas like this. Okay. Now, let's divide the retina into two parts. Say this is the retina side. Let's say here is the retina, which is towards the nose. So this retina, which I am highlighting in the violet color, this is called as a nasal hemiretina. Okay, nasal means towards the nose, nasal hemiretina. And this retina, which I am highlighting in the green color, this is called as a temporal hemiretina. Temporal means side. There is a nasal hemiretina and there is also temporal hemiretina. So every retina has two parts, nasal part and temporal part. Okay, fine. Now we know from the retina where the information will go. The information will go into optic nerves. So these are the two optic nerves. Okay, so this is optic nerve, left and right. Okay, left and right optic nerves. Now these two optic nerves, I have told you, they will cross in a region called as the optic chiasma. So this area is the optic chiasma. Now optic chiasma is going to continue as optic tract. So here is the optic tract. Now you might be thinking, sir, we already know this. Okay, why we have to know in such a detail. We already know this, like the retinas, optic nerve, optic chiasma, optic tract. We already know this, but why we are making the diagram here? Let me tell you. See, always the light from the nasal visual field. Okay, the nasal visual field, the light rays from the nasal visual field will go and fall on the temporal retina, and the light rays from the temporal visual field will come and fall on the nasal retina. Okay, something like this. Look at here, the light rays from the nasal visual field will fall on the temporal retina, and the light rays from the temporal visual field will fall on the nasal retina. Same here also. So you can say something like this. Okay, your nasal retina is always looking at the temporal visual field, and the temporal retina is always looking at the nasal visual. Okay, so now let's draw the neurons from here. See, this is the neuron, okay, which is carrying the information. Look, it is carrying the information from where? It is carrying the information from the nasal hemiretina. Okay, and this is the neuron which is carrying the information. Okay, this is the neuron which is carrying the information from the temporal hemiretina. Okay, look, this neuron is coming like this. It is going the green color neuron, and the green color neuron from here. Okay, the neuron from the temporal visual field is coming like this, and it is going into the optic tract. But look at the violet neuron. So these neurons, they are coming into the optic chiasm, they are crossing to the opposite side. And here also same, the neurons, they are coming like this, they are crossing to the opposite side. So now tell me, which neurons are crossing to the opposite side? It is the nasal retinal neurons. It's the nasal retinal neurons which are crossing to the opposite side in the optic chiasm. But the temporal retinal fibers, do not cross. They are traveling ipsilaterally. Okay. Now, why this is very much important for us? See, back to the optic chiasm, what is it? See, here is optic chiasma. This is a crossing. And back to the optic chiasma, what do we have is a pituitary gland. Let's say here the person is having the pituitary gland. Okay, this is the area where the pituitary gland is present. Now today, because of some tumor to the pituitary gland, maybe prolactinoma or some other tumor is there. Now our patient is having a tumor to the pituitary gland. Now this tumor is going to enlarge. The tumor is going to become big. So it will start to compress the optic chiasm. Definitely, it's going to cause the the mass effect, and it's going to compress the optic chiasm. So now you tell me, whenever the optic chiasm is getting compressed, okay, whenever the optic chiasma is getting compressed, so tell me which fibers are mainly affected? Is it the nasal fibers which will be affected, or the temporal fibers which will be affected? See, whenever the optic chiasm is getting compressed, it is the nasal retinal fiber. See, this violet color fiber is first affected. Okay, so these neurons are first affected. So now tell me, which visual field will be lost? Whenever the optic chiasm is getting compressed, it is the nasal visual field which will be, nasal retinal neurons. The nasal retinal neurons which are affected. So which visual field will be lost? It's the temporal visual field will be lost. Okay, it's the temporal visual field will be lost. So now you understand why a patient with a prolactinoma is going to have the bitemporal hemianopsia. This is the reason. Okay, whenever the person is having the pituitary gland tumor, it's going to cause the compression of the optic chiasm. Whenever the optic chiasm is compressed, it is the nasal retinal neurons which are affected. When the nasal retinal neurons which are affected, that's going to cause a loss of temporal visual field in both the eyes. So in both the eyes, there is a temporal visual field will be affected. Okay, so now write nasal retina sees, means your nasal retina always look at temporal visual field. Nasal retina always look at the temporal visual field, and the temporal retina always looks at nasal visual field. Okay, now tell me whether this statement true or false. The nasal fibers cross to opposite side via optic chiasm. In the optic chiasm, they are crossing to opposite side. Okay, and what is happening in the optic tract? If you look at an optic tract, look, so this is the optic tract, right? So here is an optic tract. Now you tell me, in an optic tract, which fibers are present? Sir, in an optic tract, there is ipsilateral, same side, ipsilateral temporal fiber is present, as well as contralateral nasal fiber is present. Ipsilateral temporal, contralateral nasal fibers are present. So yes, in an optic tract, there is ipsilateral temporal fiber and a contralateral opposite side nasal fibers are present. Okay, now? So now, what is the clinical importance? Look at the clinical importance. See, if a patient is having prolactinoma, already I have taught you. In a patient with a prolactinoma, it is going to cause a compression of the optic chiasm. Whenever the optic chiasm is compressed, it's a temporal visual fields will be lost. So in both the eyes, that is bitemporal hemianopsia, bitemporal heteronymous hemianopsia, not the homonymous hemianopsia, because in one eye this side is lost and the other eye the opposite side is lost. It's a heteronymous. Okay, in one eye this side and the other eye this side. So the temporal visual fields are lost. So it's not a homonymous. It's a heteronymous hemianopia. Okay, heteronymous. Okay, so you can very clearly see in both the eyes the central vision is okay, the nasal vision is okay, the central vision is okay, but the peripheral vision is gone. In the same way, now what if the optic tract is damaged? Now you know when optic tract is damaged, ipsilateral temporal fiber is affected. Look at here. See, when this area is damaged, tell me what will happen when this area is damaged. The ipsilateral temporal fiber is gone and contralateral nasal fiber is gone. So how the visual field will be? See, imagine these are the two visual fields of both the eyes. Okay, two visual fields of the both the eyes. Now, let's say in my patient, this is the left side and here is the right side. Okay, left and right. Now, the lesion is on which side? Tell me, the lesion is on the right side. Lesion is on the right side. So now tell me, what will happen on in one eye? See, in one eye, which visual field will be lost? In the right eye, let's say, see, this fiber is affected. In right eye, it's the nasal visual field which is gone. Okay, nasal visual field is gone. So, in right eye, it's the nasal visual field which is gone. But in the other eye, see what is happening. Because of the damage to the contralateral nasal fiber, this contralateral nasal fiber is also affected, right? So, let's go back. When the contralateral nasal fiber is affected, so in the opposite eye, it is the temporal visual field which is lost. Temporal field is affected. Okay. So, in the opposite eye, it is the temporal visual field which is affected. So, something like this. So, in one eye, it's the temporal visual field which is affected. In one eye, it's the nasal visual field which is affected. Okay. So, that's why it's called, it's a homonymous, means same side. See, it's the same side. Okay. Here, this side, only left is affected. Okay. So, this is called as a homonymous. Okay. Hemianopia. It's not bitemporal, it's a homonymous hemianopia. Why we are calling it as a homonymous? Because it's the same side. In one eye, the temporal visual field is gone. In the other eye, it's the nasal visual field is gone. Okay. That's why homonymous. Next. So, we are done with the optic chiasm and optic tract. Now, we have to know where this optic tract is going. Now, the optic tract is taking the information to the lateral geniculate nucleus. Okay. So, now let's take the heading of lateral geniculate nucleus. Lateral geniculate body or the lateral geniculate nucleus of the thalamus. So, it is made up of how many layers? There are 6 layers. So, students, please look at here. These yellow color things, these are the 6 layers of the lateral geniculate nucleus. 1, 2, 3, 4, 5, 6. 6 layers are there. Now, tell me, please tell me, what is this area that I am highlighting? Sir, this is the optic tract. This is the optic tract. And how can you say this is the optic tract? Because see, there is the ipsilateral temporal fiber and contralateral nasal fibers are coming. Okay, contralateral nasal fiber is coming. So, yes, definitely it's an optic tract which is made up of 2 different types of fibers. Now, my question is, the layer number, see, 1, 4 and 6. What is the specialty of the layer number 1, 4, 6? You have to first see the input. Look. The layer number 1 is receiving a dotted line and layer number 4 is also receiving a dotted line and layer number 6 is also receiving a dotted line. So, what I am trying to say, the layer number 1, 4, 6 of the lateral geniculate nucleus is receiving which type of fiber? Which type of fiber? Contralateral nasal fiber. The contralateral nasal fiber, it is going to layer number 1, 4, 6. And who else is there in the optic tract? There is ipsilateral temporal fiber. Where the ipsilateral temporal fiber is going? The ipsilateral temporal fiber is going to layer number 2, 3 and 5. That's it. So, input completed. We have completed the topic of input. So, tell me lateral geniculate nucleus is having how many layers? Lateral geniculate nucleus is having 6 layers. Out of which the layer number 1, 4, 6 receives the fiber from the contralateral nasal retina and the layer number 2, 3, 5 receives the fibers from the ipsilateral temporal retina. Okay. So, right. Layer number 1, 4, 6 receives fibers from contralateral nasal retina. Layer number 2, 3, 5 receives the fiber from ipsilateral temporal retina. Done. Input completed. Now, after discussing about the input, now let's see about the output. Okay, output from the lateral geniculate nucleus. Look at this diagram, guys. Tell me what is something special about the layer number 1 and 2. Look at the layer number 1. Here is the layer number 1. Here is the layer number 2. See, from the layer number 1 and 2, these violet color fibers are coming. Okay. And from the layer number 3, 4, 5, 6, the green color fibers are coming. The green color fibers are coming. Where they are going, sir? Look carefully. Where they are going? See, they are coming and together the layer number 3, 4, 5, 6 is forming a pathway called as a parvocellular pathway. Layer number 1 and 2. Okay, look at here. The layer number 1 and layer number 2, they are forming a pathway called as a magnocellular pathway. That's the output. Okay. So now you can very clearly say the layer number 1 and 2 gives rise to the magnocellular pathway and layer number 2, 3, 4, 5 gives rise to, 3, 4, 5, 6 gives rise to parvocellular pathway. These are the outputs. Okay. So write magnocellular pathway from layer number 1 and 2 and parvocellular pathway from layer number 3, 4, 5, 6. Now you will be having it out. So okay sir, finally we understand there is a magnocellular pathway and parvocellular pathway, fine. But what is the importance of this magnocellular pathway and parvocellular pathway? What exactly they are doing? See, magnocellular pathway, I always remember like M for M. They are going to have what kind of visual information? They are going to take the information about the movements. They are going to take the information about the 3D vision or stereopsis. Okay, so movements, 3D vision, stereopsis, flickering. So these information, if something is moving, I can actually feel it, I can know it. So the information about the movements of the objects is carried by the magnocellular pathway. And what about the parvocellular pathway? Parvocellular pathway is carrying the information about the color vision, colors, fine details, texture. Okay, these information. So these informations are going to via the parvocellular pathway. So via the magnocellular pathway and parvocellular pathway, which are nothing but the geniculate tract, the magnocellular pathway and the parvocellular pathway, they are finally taking this information where both these pathways are going to the calcarine sulcus. This is the area called as the calcarine sulcus, which is nothing but the primary visual cortex, the Broadband's area number 17. So this is the area where you can actually form the images. Okay, by decoding that information, the cortex will decode this information, these electrical impulses, and forms the images based on that. Okay, so this is how the information is going to the Broadband's area number 17, or you can say we have completely discussed about the visual pathway. Okay, with this, all the important points which are needed about the vision are completed. Hope the video is helpful. Thank you.